Hi, I'm Rahel Briggs, the National Director of HealthySteps. HealthySteps integrates an early childhood development expert into pediatrics, and this new team member supports screening, intervention, and referrals to needed services, from autism to maternal depression to social determinants of health. Over 25 years, our program has emerged as a leader with significant demonstrated impact across 2 generations and a commitment to closing health equity gaps. The pandemic has made glaringly clear that health equity is a huge problem in this country, and it starts with babies. While 1 in 5 babies are born to families living below the poverty line, that has doubled and tripled respectively for Hispanic and Black families. Early adversities literally get under the skin, changing brains and bodies potentially for a lifetime. We need to reach babies during this most critical period of brain development, birth to 3, in the single system with the capacity to reach them, pediatrics. Prevention is the key to closing these gaps. Our early childhood system is siloed, home visiting, pre-K. None are scaled anywhere near pediatrics. Pediatric visits alone aren't enough, but the system must be at the center of our approach to influence collective prosperity and flourishing. Let's look at one site doing groundbreaking work, closing equity gaps in the most disadvantaged neighborhood in our nation's capital. HealthySteps at Children's National Medical Center reaches over 4,500 families annually, the majority of whom identify as Black, and the HealthySteps team reflects the racial and ethnic backgrounds of these patients, building trusted relationships that ensure universal screenings, in-house intervention, and effective follow-up to needed community services like early intervention. Racism persists in our education and health systems, and families understandably refuse referrals for fear of tracking their children into dead-end paths. HealthySteps transforms these paths. Randall Baylor, a HealthySteps team member, DC native, and parent in the community, works to rebuild trust, answer questions, and ensure children receive these trajectory-changing services. HealthySteps in DC quadruples the likelihood of successful early intervention referrals, and children receive the needed developmental services to set them on the path for school success. And that's just one example of many. We currently serve more than 300,000 babies and families in 190 communities, and we've grown an average 17% year over year, outstripping our projected 5% growth. Imagine the future if every family had access to HealthySteps, if every practice had a Randall, with an ongoing cost as low as $5 per family per month. We ask for additional funding to support this remarkable demand and help us transform the lives of children and families and close racial equity gaps that otherwise persist across healthcare and across this country. Thank you.